Kia ora.
Kia ora, Dana. Kia ora koutou. Yeah, just to reiterate, just to repeat the warm welcome to you all. I'm Tania. I'm from Te Roopu Waiora, and I'm acting as your facilitator today. So I hail from Ngāti Awa. I work as a researcher and have been part of our community for probably too long. But yeah, it's awesome. What was really important about today is all of you are leaders in your communities. And we wanted to have a conversation where you get to ask specialists your questions so that you can go back into your communities and have the talk. We know that the community that you're part of, listen, they're influenced by you, and you're our leaders. Whatever part that you work in, we recognise that. So this is a talk among leaders. Unfortunately, we only have a little bit of time, but we might do this again, depending on how things go. So we've got some tikanga that we're going to follow today, just so we can get through things easily. So I'm going to ask our manuhiri to introduce themselves first, and then after the tikanga, and then I'll start asking those of you who have sent your questions in. I'll ask your name and you ask your question, whichever way you want to ask it. We've given it to our guests so that they're prepared. Please don't ask weird and wonderful questions. Try and stick to the ones that you sent us. But if you have questions that you feel are important, haere koutou, just ask. So first of all, we're going to keep you on mute unless you're talking. And that's just to cut out all the background noise. If you're going to use the reo, then, and we certainly encourage that, it's just that today we don't have sign language interpreters who have the reo, and we have a number of whānau who don't speak the reo. Any reo you use, that would be really helpful. Some of you have sent in several questions. What we're going to do is get you to only ask one at a time. We'll go around, and then when everyone else has asked their one question, you can ask yours. And we'll keep it flowing that way. If your question is answered, or if you recognize that your question is answered, then don't answer it again. Don't ask it again. But if you haven't heard it, ask it. Kei te pai. Don't give us a long kōrero with your question. We haven't got enough time, only because we don't have enough time. But we're going to have another hui, because what your experiences are and what you have to say is really important. So we'll have another hui next week, and we'll invite the providers, the service providers, to come and hear what you have to say. They may learn from you. So we'll do that. But at today's, we're just going to give the time mainly to Lily and Anthony. If you have questions and you haven't given them to us in advance, then we'll hopefully have enough time after the ones who have to ask for questions to come up. Are we good? Kei te pai? Cool. Okay, I'm going to hand over now to Lily and Anthony to introduce themselves.
Well, tēnā korua, hui anō tēnā koutou, Dana, Tania Kingi, koutou katoa. Kei te mihi arohatu kia koutou, ko whakariti tēnei kaupapa, ko whakawātea mai te ara kia mātou, kia māua ko Anthony. Kia ora everybody, thank you Dana and Tania for the warm welcome. It's really great to see so many of you on here representing your community and your whānau. So I'm really excited to be here to talk to you today. My name is Lily Fraser. I'm from Naitahu, from Dunedin. I was born there but raised in Auckland. I went to kura kaupapa and kōhanga reo in West Auckland at Whānau Hauā Marae. Now I'm a GP, a doctor, at Turuki Healthcare, which is a Maori provider in Mangere. We also have a clinic in Panmure. And so, yeah, I've been doing lots of these hui about COVID and about vaccination. And I want to thank you for inviting us today. Hand over to Anthony.
Kia ora tātou, ko Anthony tēnei. I am a clinical immunologist, which is a doctor that specialises in the immune system. And that's my interest in terms of COVID as a disease. And more importantly, what we'll be discussing today is the role of vaccination in terms of protecting us from COVID. I went to medical school with Lily. I'm from Ngāti Wai. I grew up in Te Tai Tokiro and went to school in Whangarei, but have actually spent most of my life here in Auckland. So it's a real privilege to be able to answer your questions. I've had a look through your questions and I just want to say they're really thoughtful questions with some interesting ones in there just to keep us on our toes. So we're really looking forward to being able to answer those for you today.
Kia ora korua mō tō mahi whakahirahira. He mihi mahana kia korua. Thank you both for being here. Warmest greetings for the important work that you do as well. So the first person who I'm going to pick on today, and I'm going to ask our turi whānau to be the ones to ask the questions probably first, for the sake of our interpreting. Todi, if you'd like to ask your question.
My name is Todi. I'm involved in, I'm a member of Te Roopu Waiora. So I wanted to welcome the Dr. Anthony. And I did have a question I wanted to ask about the COVID vaccination. So after the first and the second vaccination, is it possible that a third and a fourth vaccination would be required? So, and also with the vaccine, is it 100% effective? Will it fully protect us 100%?
So kia ora Todi. In terms of will there be further vaccinations? I expect there will be. We've seen already how much COVID can change, and that's what viruses do. And so like the flu vaccine, we may end up having either a slightly different version or a booster, which is the same one, but just to give us another boost of that vaccine at certain times. And so at the moment, what we don't know is how often that will be. It might be once every year. It might be longer, it might be shorter. So yeah, I guess that's, we can't predict the future. Anthony might know more on the inside. In terms of how effective it is, this vaccine that we have, the Pfizer vaccine, was actually developed against the first COVID strain that we saw, right, the Alpha strain. And so what we know is now we mostly have the Delta strain in Aotearoa. And so they have done research already looking, does the Pfizer vaccine protect you against Delta as well? And what we've found in that research so far is that it does still give you really good protection against Delta. It's probably a little bit lower than Alpha, but the most important thing is actually that it still prevents you most of the time from getting it, and then more importantly, going to hospital or dying from it. So the protection is still really good against Delta, but it's not 100%.
All right, thank you. And
to add to that, the the likelihood is when we will need a booster, somewhere around 6 months, 9 months after your first dose, depending on what age group you are, whether or not you have other conditions that mean your immune system is likely to need a memory check as well. And the reason that Lily said is we want to ensure that the protection, that high level protection to stop you getting really sick and ending up in hospital or dying, continues to remain in that 90% area. So you'll probably hear figures like 95%, 92%. When you look at a clinical study, movement between 92 and 95, it just means that it's pretty much the same effectiveness. Those little movements are probably not significant in terms of overall protection. One of the things that we know now is it's better at stopping you getting really sick than it is transmitting it. So we're looking now at vaccines that may be better at stopping us being able to transmit it. So not being able to pass it in households, because it did that a lot better with the first alpha variant than it does with the delta. So that's where the new vaccines are being worked on now.
I'll just add something to that. I've heard some people say, well, they'd rather wait for the ones that might come, right? So if there is a better vaccine in the future, well, maybe I should wait for that one. My advice is actually get what we have now, right? And in the future, if there's a better option, then I think then we would go for the better option. But right now, this is actually our only choice, and I think it's a really good choice. So I'm not worried about having received the Pfizer. As Anthony said, it might be wearing off a bit at me because I got mine back in April or May. So, maybe I'm going to need my third one sooner than you guys if you haven't had it already.
Yeah. The best analogy for this is I wouldn't drive down the road without a seatbelt on just because I'm waiting for a better seatbelt. You always put the best level of protection you have now in front of you. And yes, something better may come along, but you can have that too. It's not a or situation. You can have both things.
Oh, fine. Awesome. Thank you. Whiti.
Kia ora koutou. Now, my question is in regards to the first vaccination. I've had my first one. Now, I went to the car park and the guy said to me, he started talking to me behind his mask. And I tried to say, I'm deaf and I need to be able to see your lip pattern. And that's one of the major problems that we come across as ture whānau. He looked at me and he was quite aggro towards me, and I tried to say to him, calm down. And so when I went in to have the vaccination, those are the problems I come across. I very clearly signed I am deaf, and I told the person to please remove your mask so I can lip read, follow your lip patterns. That person understood and was able to follow those instructions. That person also rang the nurse and let them know a deaf gentleman's coming here. He's on the premises. There's no interpreter. I didn't have an interpreter at that time. And so, that would have created a barrier. But they need to be able to follow my requests as an interpreter. So they should be able to have some sort of backup plans and be ready for us when we come in as ture whānau to know what to expect and how to work with us. They asked me, some word like healthcare, and I asked them to write it down. And they says, do you have any problems? They'll be writing these 5 questions down for me. And I had no idea. If you think about it, English is my second language. And so, would I want to know, if I don't have the first or the second one, would I die? But these are the questions that they should ask me before I have the jab. So I'd probably go ahead and have my second one. I had the first one on that arm, but 2 days later, I felt a little bit woozy, and I had a bit of a headache and a little bit of the flu, a little bit of the cough as well. You know, I was a bit, my body was a bit aching, sore, he says. So, you know, and I was just wondering, is that a result of the injection? I didn't think it was going to make it worse for me. So the other thing too is when we go into places like that, they should put a note, deaf, just to make it safe for us and to ensure that we get the right information and not get confused with information coming at us. If we don't have an interpreter, they should know, we indicate we're deaf, or they should prepare by bringing an interpreter on site for me. But there was nothing. I was there, I was stranded on my own, trying to navigate my way through that COVID experience. I've got a second one coming up, but I'm not sure. I've got a little bit of a cough, but I'm just going to make sure that I'm fully feeling well before I go on. But I mean, it's been 10 weeks since my first jab, and I still got a little bit of a cough today. I had one I noticed it this morning. So yeah, that's my korero.
Kia ora, Whiti. I think those are really good questions, important questions. I know the masks are really hard if you are lip reading, and that has happened to me. And so what I did was I wore my visor that is see-through. So I took my mask off, but you could still see my mouth. I also made sure that I had more distance. So I sat further away because I didn't have the mask protection. So, I think that's one option if it's inside. Another option maybe is to think about if there is somewhere that does a drive-through vaccination, that maybe you could, they could talk with the window closed. So you're protected in your car, but you can still see them if they take their mask out, but the window is between you to give some protection. So I guess that's another option if there is a drive-through option by you, as a way of you feeling more protected because they don't have the mask on. I have seen masks that have a clear cutout, but I haven't seen them available routinely in New Zealand. So I know people are thinking about it, but it's obviously not available everywhere yet. In terms of your cough, I think what you have done is the right thing. It's better to wait until your cough is better. But if you have had your cough for a long time, it probably is worthwhile arranging an appointment with your doctor. Maybe they can do it by video. That's another thing I thought. Maybe by video is actually better because you can use, I don't know if you can use your phone as a video. So you can see them speaking, but they can be inside and you can be in your car. I mean, there are lots of ways we can use technology to be able to help you be able to see people's faces. So I guess those are some things to consider. But I feel like, unfortunately, often you must have to advocate and tell people what to do because they might not have thought of it already, which makes it more difficult. I think maybe next time, I don't know if you can book the interpreter to take with you, or take, if there's someone, if there's someone from your whānau that you could take. But probably one of these interpreters would be awesome. It depends where you are.
So Whiti, on the website for your booking, under language is NZSL, and no matter where you are in the country, even if you're in the Cape, no matter what, we will find a way to have a sign language interpreter there to interpret. It may be in a Zoom version, it may be on a phone with a video connection, or it may be in person. Because actually, that's the best thing, because it allows you to keep you safe, and to communicate just like you normally would, not having to make compromises.
Does that answer you, Fitzy?
Oh, you were worried
Yeah,
about...
Kate Pai. Thank you so much, he says.
Fitzy was worried about the side effects.
Oh, yeah.
Yeah.
Those are okay signs to have for 48 hours. That's pretty normal to get those. I woke up at 2 a.m. and thought I was going to vomit, and then I thought I was just making it up in my head, but it was probably a side effect. But I'm not too worried about that.
And also, each time you get the vaccination, it's different. So my first one, I was very sore. My second one, I was hardly sore at all. And I had a mild fever one night. So you can't predict each time what it's going to be like.
Cool, thank you. I'm going to ask you, Karen, to ask your question. And while we get the pinning right, just to say too that if you're going to book a sign language interpreter to be on site, then what we're asking the providers to do is to book the most senior sign language interpreter that they can get in case lip reading can't happen. Get the most senior sign language interpreter to make sure that the communication through sign happens. So we'll certainly take that to our provider hui. Karen, you've got a question?
So I've got one question that I've been contemplating. I'm just thinking about my whānau. I have a number of whānau who also have health conditions, asthma, skin allergies, food allergies, medication, which clashes quite a bit with other things. But my question is, for the whānau, some of them have had those first jabs and the second, but they haven't had any side effects over the 48 period, because we have been monitoring them. But we also want to help the deaf community know that the information, that comes to them is received well. But also, one major concern I have is, can you or anyone explain it to me about, in regards to the community, immunisation, or, sorry, interpret it. I'm just going to get the HER or the HERD.
Herd immunity.
Yeah, herd immunity. So I'm just wanting to know, how can we protect that from spreading? So that's my question to you. The other one also, what do we do, in regards to the deaf community? A number of them don't understand the information that's coming at them. Even if we pass, how do we pass that information on to them so they are able to understand in regards to the COVID, so that they are empowered to be able to make their own decisions and understand the information that's coming at them? So anything linked to the COVID, the information, like they would watch TV, they'll look at the news, I think it's okay, but do they really understand the bigger picture of things? Or, and they rely on subtitles, which means, if you think about it, English may not be their language. Are there any development of resources or any way that we can make connection for the deaf community to ensure that they are able to have a clearer understanding? So those are my questions to you.
Do you want me to start with that?
Yeah, you can start with that allergy one.
So the allergies are not a reason to not have the COVID vaccine. There are no food allergies, no hay fever, no skin conditions that stop you having the COVID vaccine. And that's very well studied. So lots of people with allergies have taken it and been perfectly well. The next question, I think, was around herd immunity. I think a better way to talk about herd immunity is saying how we protect our whānau, how we protect our community by being vaccinated. And people explain it in different ways, whether or not we are roadblocks in terms of stopping the virus spreading through our households or our communities. And that's kind of the concept of herd immunity. At the moment, the number of people to be vaccinated to see that work is quite high. So we really need people to get vaccinated, and we're looking at hopefully getting over sort of 90 to 95%, where that's where herd immunity may start to kick in, that ability to protect people who have not yet had the vaccine. For example, our tamariki, those younger than the age of 11, for example.
Right. Yeah. And also in terms of other health reasons, so you said things like asthma, but maybe things like heart conditions, cancer, epilepsy, things like that. None of those are a reason to not get it. But if you are worried about your health, like if you have a specific thing that you're worrying about, or if you're on medication, then I would suggest talking to the nurse when you go in, or talking to your own doctor before you go in for your vaccination, just to get your own health checked through before you go. There are some things like cancer treatment where certain times of like before chemotherapy, your immune system is going to be stronger. So that's a better time to have the vaccination. And so anybody who is having treatment at the hospital, their doctor at the hospital will be the best one to say when the best time for the vaccination is. In terms of resources for the deaf community, I think that might be something that maybe Tania knows more about. I don't know, like, I suspect in this group you probably know more than what I know. Have you got any suggestions, Tania?
So on Deaf Aotearoa, there are a couple of videos there and some resources. So Susie Wiles done a video, I've done a video, and I can't remember who the third person was, done a video around answering questions, and similar to what we're doing here, but actually it included some more funnier bits about people's own experiences when they went to get vaccinated, about what they were worried about and what they had happened. So it was good because it actually shared what it was like to be vaccinated, rather than just experts telling, the same things over and over again. So it was really interesting to be part of that because just like your story, Whiti, there was a lot that we learnt about that changed the way we approached vaccination for our deaf community.
Just to add to that too, you're right, Anthony and Lily. What we're doing here today is giving you information so you can take out to your communities. But the other thing that is really obvious is that cultural communities who have disabilities need to work in that space more actively with resources. And so we're having to do a lot of work around the disability sector, recognising the cultural groups within those sectors and doing some work along those lines. So thank you both for that. And I think I have Carol Rafferty. Carol, have you got a question that you wanted to ask? So a question came in from someone named Carol. So I'll ask this one. How safe is my mahi if 4 out of 30 staff have not been vaccinated because of their religious beliefs, and one being an anti-vaxxer? I work at a school.
Sorry, can you just repeat? Sorry, can you just repeat that question again, just a little bit slower? Thank you.
How safe is my work if some staff have not been vaccinated because of their religious beliefs, and one being an anti-vaxxer? I work at a school.
You want me to go on that one, Lily?
Yeah, you can.
So that was 4 out of 33?
4 out of 30 staff.
Okay. That's pretty good rates, to be honest. You know, there are some workplaces where they wouldn't get to 80%. And I think the thing I would say is there's other things you can do as well to protect people, and that would be physical distancing, mask wearing, hand hygiene, and having conversations with them about why they've chosen not to be vaccinated, and do it in a really non-confrontational way. When I talk to people who I know are not comfortable with the idea of vaccination, I talk to them about why I choose to get vaccinated, what motivated me. It's not because I come and do talks, it's not because I'm an immunologist, it's because I want to survive if I got COVID. I want to be able to have a life with my partner. I want to be able to see my family, and I want to be able to protect my community. And actually, a lot of religious groups believe in those exact same things. So it's breaking down those barriers to show them that actually we all have some common beliefs, and we don't need to separate it based on what they believe vaccination is. Because actually what motivates us to get vaccinated is very, very common.
Did you want to add anything, Lily?
I don't know if the Ministry of Education is going to put something out about this. Have you heard, Anthony?
Yeah, it'll be tricky. So what Lily's kind of referring to is what the mandate may be to be able to work in schools for teachers and be unvaccinated. But disincentives are not great ways to get compliance. You know, bringing people with you for all the positive reasons is really important. So I don't want to lose teachers, let's put it that way, for whatever reason, their choices or getting sick.
Awesome answers, thank you. Les Mahia, you've got a question, Les. You're on mute, Les.
Yeah, kia ora everyone. Yeah, I had a question, but I felt like you've actually answered one of them, so I can take that off, make it a bit easier. But I do have one in regards to food. Will that offset, will certain foods offset when you get a vaccine, like having too much protein intake, or will meats or seafood affect certain body types in regards to, and plus using supplements too?
Kia ora, Les.
Right.
No, it doesn't really matter what you're reading in terms of, you know, when you have the vaccine. Obviously, we want to be as healthy as we can. So some people say, well, I'm just going to build my own immune system to be strong, and I don't need the vaccine. What we say is do both, right? So get the vaccine and keep yourself well through kai. I think keeping yourself well through kai is really important. And so everybody's got a different level of immunity, how strong their immune system is. And definitely a healthy diet, is an important part of having a strong immune system. But in the same breath, some people can eat really well and still have serious medical conditions. And so it doesn't make you bulletproof. And so I think that the more things you can do, having a good sleep, managing your stress, doing exercise, getting fresh air, and having the vaccine all together are the best protection.
Anything to add, Anthony?
No, I think Lily covered it all.
Ka pai. Dana, you have a question?
Yeah, I'll change my question, but anyway, my one is about why are the numbers still so high in South Auckland? Is it because of the poor health we have in South Auckland? Is it because of poverty? The high numbers of cases, is it because there is so much, kind of put it, there's a lot of homeless, there's a lot of depravity amongst Maori in South Auckland? Is that why we have COVID numbers still high and that it may never leave Tamaki ki Tonga?
Yeah, I mean, I think everything you said contributes, and ultimately what we've seen with Delta is that it spreads more easily, right? So its ability to pass from person to person, it's very clever. And so if we, if our ability to reach everybody was the same, and I think this is something that you guys can understand, is that the message doesn't fit everybody, and the way that we reach out to people, you're going to get a lot of people watching and understanding, but there's also a lot of people, for all the reasons you said, and others, who that message either isn't reaching them. Maybe they don't have internet to be able to watch the updates. Maybe they don't have data, or the message, their experience of what they have seen from the government or received from the government, hasn't been a positive experience. And so they don't want to participate in what's being requested of them. And you can understand where that's coming from. So I think all of those things that you've talked about is what we're seeing in South Auckland. And just last week, Turiki has started working with some of those whānau where, MIQ is not what they want. And so supporting them to be able to stay in their own home and protect themselves there, working with whānau that are in transitional housing where, there's a lot of whānau in one building, all those things that make the ability to stay away from other people harder. We can't just say something, expect everyone to do it. It needs to be often kanohi ki te kanohi. When you do things face to face, you're going to get a different response. If you do it with respect, you're going to get a different response. And so the way that, because we're all trying to stay distance, we're all trying to do things by phone, some of those things just don't work for some whānau. So yeah, I think exactly what you've said, but that it's also just not in South Auckland. And I think, we've seen, because we had such a big an event, the numbers in South Auckland have been very high, but it is also in other areas who don't have poverty in the same way that we do in South Auckland. And as we know now, it's spread beyond the borders. And Anthony will know more about the stats because he's all over that.
Yeah, I think it's sadly a tale that's been borne out in every health statistic pandemic that's gone before is illnesses rip through communities that don't have the same level of resources to protect themselves. And that's no different this time. And that's economic resource, all of the other resources that people need to keep well and safe and economically protected under a sort of scenario where we're asking them to stay home. And there has also been, as Lily said, a lot of fear about being stigmatized. If you get a test and you become a case, you get taken out of your home. People think differently of you at work. The problem when the numbers are low, and I may just say that the numbers in New Zealand look like they're going up, and they are, but in a worldwide sense, they're incredibly low. So the 41 people that were diagnosed today are almost able to be picked out street by street. And that's very shaming in some sort of level, that a community can be picked out. And that's sad, you know. For me, it's all about how do we protect these people, not how do we isolate them off and create ghettos of unwellness, because that's part of our response. The bad side to it is that we're creating this stigma around COVID, like people choose to get COVID. It's not a choice. And households don't want to be affected by COVID. And so we've got to change our message to being, how do we protect ourselves from COVID so that it's a disease that isn't looked upon as a kind of stigma.
Thank you. Holden, sorry, you've been waiting for a while. Holden, you have a question?
Great. She's just asking, oh, yes, sorry, I had my hand up for a long time and everybody else was asking their questions. But anyway, you know, while we're on the subject of vaccination, I've had my first vaccination. I didn't have an interpreter there, like Fiti said. Very disappointing. Communication was very hard. And that's true. I felt stuck. The second time I went for a vaccination, same sort of thing. No interpreter. I told them that they need to book an interpreter because I'm deaf and that they should know better. And there was no response. You know, I really object to that I was treated like that.
Mm. Yeah, fair enough. Yeah.
I agree with you.
Yeah.
Yeah, that is bad. Full stop.
And just to carry this on, we're going to have another hui whānau, and we will invite you to the next Zoom. We're going to ask the service providers to come along and hear your experiences so they learn from you. And we're going to do that within the next week. So thank you for bringing those issues to us, and we'll definitely put that hui on.
Can I just say that, I mean, sometimes that is, if you go to a big vaccination centre, if you go into a big vaccination centre, then people aren't going to know you, or necessarily you might not feel that you're being heard so well. And obviously the ideal is that wherever you go, you get exactly what you want, and the service you deserve, and is your right. So I'm not trying to.
Yeah, that's right. So,
I'm not trying to make.
Why should they?
I'm just
thinking, they should know better. Yeah. And the doctors, I did tell them. I said to them when you please book a sign language interpreter. And there was no response to me. No one responded. It's not good enough, really. Yeah. I did try to remind them. I tried to tell them. It was almost like I've been ignored, not even listened to.
Terrible. But I'm glad you got 2. Well done for doing it anyway. I'm really proud of you.
Yeah. But in the meantime, I'm still not happy that I didn't get a response. I had to take that courage and be able to navigate, through the communication, words that I didn't know, I didn't understand, So these are the things that are lacking over there. It's very hard for me to be able to communicate with them, or vice versa even.
So what I was saying is I know that's not okay, but if you do have a doctor that you trust and they provide the vaccinations and you've got that good relationship, maybe actually choose to go to them. where you have the choice in your community. And I know in some places, if you're in a small town, you don't have a choice, but I think the people that know you are going to serve you the best, even though obviously everybody should.
But nah, I just felt like, you know, I was very, very disappointed, you know, because of the lack of communication. You know, the nurse should, you know, try and respond and cater for my needs. It was very hard.
At our next hui,
You know, and, you know, 2 days I was sick. I didn't know why. You know, and I thought, you know, is it that injection? Why am I feeling this way? You know, it wasn't good. And I'm answering these questions to myself because I didn't get the information. Tanya.
At our next hui, what we're going to ask you to do is give the solutions to the service providers, because they're not going to know. They're not going to know how to work with you. You are the best people to be able to give them the information around what works for you. So at the next hui, we'll get you to tell the service providers, this is how you need to be providing services to us. Kei te pai? Cool. We've got Wayne. Wayne, did you have a question to ask?
Kia ora, nā mihi kia koutou. Yeah, my question is similar to the teachers and not being vaccinated, similar. Myself being in a wheelchair, and I have caregivers from the community. I've got most of my carers have been vaccinated, but a couple of them won't take the vaccine due to their own personal reasons. How does that affect me being close contact to these guys? It was going to backfire. What have they got the information on? If someone doesn't get vaccinated or someone that has been vaccinated, what's going to be worst scenario, say?
So there's two things to say. You can choose a different caregiver. We are asking our caregivers specifically to tell us if they're vaccinated or not, just as we would for our other hospital staff. And for people who don't feel comfortable that their caregivers are not vaccinated, we can look at swapping those people out. We're also having conversations with them to have a discussion about why they've chosen not to get vaccinated. And then the last bit is we can still put other measures in place to protect you, like mask wearing, hand hygiene, but that's kind of that's the last resort, because actually, although those things work, often being a caregiver requires quite a lot of close proximity, and those measures work okay, but they're just not as good as being vaccinated and all of the other things we could do.
So the interaction between myself and the non-vaccine person, was there any danger in that?
Well, you're more protected than they are, let's put it that way. Once you're vaccinated, you're a lot safer than they are. But actually, both of you being vaccinated is the best situation. So that should be the goal.
Yeah, I'm not in a position to force people what to do. So,
but we as a provisioning agency who send caregivers out can have that discussion with our staff. So I don't think you have to do that yourself, but you can ask the organisation that provides your caregivers, hey, can we talk about this? Can you talk to your staff? I would like my caregivers to be vaccinated, because that's a fair request.
Yes, I think that's got to go to maybe the agencies that run these caregiving agencies. Maybe they should put their hand up and do the mandate instead of putting us in a position where we have to fire people after we've invested time in these caregivers.
Yeah.
Not so easy to give away your good caregivers.
Yeah, and I think that's why you should ask the agency to have that conversation with them, because actually there are very few people that are truly flatly refusing the vaccine. What they want to do is actually have a conversation about it.
Yeah, and that's been our experience at Turkey. I know there are some workplaces that are making it compulsory because the risk to whānau and to each other or to ourselves is high, right? And so as a caregiver, you're going to be working closely with not just one person, but with many people. So I agree, but I also hear what you're saying, that, you know, you have a relationship with your caregivers and they know you. And so being able to continue with those people for a lot of people is important. But when we've had the conversations with staff and actually said, look, this is a requirement for your mahi, most of them have actually decided to get the vaccination.
Yeah, I think it's also their job to take off the emphasis out for the client themselves, because we don't want to be forced into the position of being the policeman, you know?
Yeah, definitely pass it back to the agency, Wayne. That's what I would do.
Kia ora.
Georgina, you've got a question?
Kia ora koutou, Georgina tēnei. There's a lot of videos out there showing people sticking spoons and money on the injection area, and they term this as being walking magnets or liquid steel. Does the vaccine make you magnetic?
No.
No.
But they're so clever, because honestly, I've watched it. I'm like, they're so convincing. But yes, nothing's sticking to me.
One person the other day that originally did the video showed them sticking it to them, and then what they did is showed how they put a magnet under a dressing, covered it with makeup, and then that's how they stuck it to them. So I don't know why these people think this is, you know, a worthwhile thing to do. You know, it's clearly they're a bit bored during lockdown.
I'm glad you've got an explanation.
Yeah, well, I've had two members in my whānau. One had tried it out and done a video, and because I have been vaccinated, I tried it on myself.
Doesn't work.
The money didn't stick. I just put it down to that the member of my family was very clammy and very careful how she lifted up her arm. Koina.
One thing about money is it never sticks to any part of my body. It always gets into someone else's wallet.
Koina, kia ora.
Kia ora, George. Hannah, you had a question. Are you there, Hannah?
Milton's got his hand up. I think he's been waiting a while as well.
Okay, so I've got 4 questions actually, but I'll try to keep it brief. Kia ora. So far, is there 28 people that have passed away in New Zealand so far due to COVID? I'm just wondering, did they have both COVID vaccinations? Were they healthy already before they had the COVID vaccinations? I just wanted to ask about that. That was my question.
So the 29 or 28 people that have died so far, none of them had been vaccinated. What we would consider fully vaccinated, so received 2 doses greater than 14 days. Remembering that the majority of the people that died before we had the vaccine in the country. So that's an important thing to remember. So once a vaccine was in the country, even though we may have seen lots of infections, we've also seen not many people die from the infection, which is a good thing. So just putting it into perspective as well.
Also, on this outbreak, because in this, so people that have received 2 vaccines, of the current outbreak, which is now over 1,500 people, only 3% of them who have got COVID have actually had 2 vaccinations. So what that means is 97% of the people that have COVID in this outbreak either weren't vaccinated or only had 1 vaccine. So it shows that the 2 vaccines is giving really good protection in this outbreak.
Yeah, hang on. I'll just get this one through and then we'll come back to you. Hannah, you had a question about whether or not it was the vaccine. Does the vaccine affect your ability to have children or your unborn child?
No.
The way that it protects your unborn child is actually to give it some protection. So when you are pregnant and you have your immune system gets the protection against COVID from the vaccination, your immune system also goes in your baby's blood because, you're sharing everything when baby's inside your puku. And so when you give birth, your baby will have some of that protection for weeks or months after they're born. But in terms of any bad things, no.
That was the question, eh? Does it affect my fertility? No.
Yes.
In Portugal, lots more people are having babies and they're very vaccinated. And that's probably because they're all happy and protected and not wearing masks, clearly.
Or had a long lockdown.
Or had a very happy lockdown, I should say. And there's lots of concerns about it affecting the unborn baby, but that's been studied now and it doesn't. So that, that question's been answered.
Yes. Cool. Thank you.
There's a question here that nobody wanted to ask, so it's left to me. Can the vaccine harm your testicles?
No, my testicles are fine, and I've had 2 vaccines. This is a question about whether it lowers your sperm count or affects your fertility. And this was a myth that someone spread based on a rat study where they gave 1,137 times the dose given in humans and showed, it turns up in testicles and ovaries, but that's because rats are small and they gave a big dose, but actually it did nothing to fertility anyway. So you're not rats.
But the rats still had babies, is that what you're saying?
The rats still had babies.
Oh, great.
And the babies were fine. They were still rats, though.
Milton, did you have another question?
Yes, go ahead. Here in Aotearoa, the 0 to 40% of the population have been vaccinated. So does that mean that all businesses, schools will be fully open when we're back at level 1? I wanted to ask that question.
Yeah, so I would think about it slightly different, Milton. I would say that at some point the population want to see less restrictions on their life, and people are comfortable once we get to a certain vaccination rate that we can do certain things, move between different areas, return to school, return to work, eat in restaurants and all of those things. But that's because we're moving into a different phase. We've now protected the vast majority of people through being vaccinated, and we have to put in place other measures to stop the spread of it. But we need to realize COVID will be here to stay. And so the numbers don't matter as much at some point. What matters is that we've protected everyone from having a bad outcome. And that's going to be a really difficult thing for people to get to terms with over the coming months ahead, because people are hoping we get back to 0 cases. That's probably not likely. And at some point, we were always going to get COVID here in Aotearoa. So I think we'll have to support each other through the next couple of months as we get used to seeing numbers that are high, but actually, hopefully what we will see is no one gets sick, and that we don't see many deaths.
Ka pai, Lily. Richard Petty. Richard, did you have a question?
That was Mornay was first, is that right?
Sorry, Mornay. Mornay, do you want to ask your question?
Mornay, you had a question you wanted to ask. Yeah, yes, yeah. Here he is. I was a little bit of confusion there. Thank you for the support. I missed out earlier about the doctor talking about booking. There are a lot of health issues that can be affected by the COVID vaccine. So I have a question. Once you have the first vaccine, she's asking about having pills. She's on regular medication. One of them is for her heart. Thank you. So is it okay to be able to continue with those vaccines? You know, she talks about the drugs or the medication that she's on. So, yeah, that's one of the questions I forgot to ask my own daughter. So now I'm bringing it to your attention. Yeah. So if you can just, yeah, I forgot to ask the doctor. So I'm just asking you. Thank you.
So what I would suggest, there's two options. One, you can just bring your list of medications with you to your vaccine appointment, and the nurse knows which ones might need a little bit extra care. So some of the blood thinner ones you need to hold on afterwards, just push a bit harder to reduce the bruising. They will know which ones those are. If you're not sure or you're worried and you'd like to be prepared, you can always talk to your own GP before your appointment, but actually the nurses do know what to look out for when you come in.
Mornay, I think this question's also in retrospect, so from before. The one thing I would say is that vaccines don't tend to interact with any medications. Medications can interact with one tablet can affect another tablet, but vaccines tend not to. So just Katie Pie, don't worry about it.
Awesome. Thank you. Richard, have you got your question ready?
Kia ora. Kia ora koutou. My name is Richard. I hope you're all doing well. Now, some of the, he's talking about access in regards to for the deaf community. I've seen some people out there not being able to make it it's not accessible for them. Now we're talking about the, also MIQ and going back to May in regards to vaccination. The interpreter has come, but the interpreter has come on, we've done it through mobile. So they've received an email confirmation. Sorry, just in regards to booking online, I get a reminder that I've got an interpreter booked and my schedule for my booking of the vaccination. So there is a confirmation, two confirmations, one for the interpreter, one for the vaccine, and I get that received via the Ministry of Education, the booking system, just to remind me as well. And I think it comes in 3 weeks in advance, and that was from May and then June. But the problem was I did have a bit of a problem with the interpreter and the traffic that was there that they had to experience. The interpreter arrived late, and I wondered if the interpreter could come, cut the line and get him first. But the security guy said no, which left me at risk. And instead of being there 1 hour, it ended up being 2 hours. But after all that, I was okay because it was important for me to have the interpreter there to be able to discuss those questions and for things to run smoothly for me. And the interpreter helped me through, you know, the questions, which were, you know, like some of the questions like, am I on medication, you know, my personal health, you know, and would I have a headache, or did I have a headache? So it was able to be, that made it accessible for me. But I know some of the deaf community out there face lots of barriers, and we need to be able to make it accessible for them. Now, this card here that I'm just going to hold up, it says I'm exempt from wearing a face covering, you know, and I've showed that to them to be able to ask them to remove their face covering so I can get the facial expressions and lip patterns. And that can be shown to various places like hospitals and doctors. And I think sometimes we need this as deaf people, because if we don't, there is communication barriers. And with this card, it is able to make it more accessible for us. So it's very important for us as a deaf community to be able to show this to professionals to make communication easier for us. Yeah, that's my question. I don't know if there was a question or not.
Kia ora, Richard. Thank you for sharing your experience with us. I think that it sounds like you did everything right. And as you know, life still happens, traffic jams and all that. But I think you've shared some really important information. And I think that card is really cool. So thank you for sharing.
Our time is moving along. Liz, have you got a question that you want to ask?
Yes, kia ora everyone. Yeah, just final question. Will there be any issues if I come in contact with another person who's been vaccinated with a different vaccination, say like the Sputnik or Moderna or Johnson & Johnson?
No, I think that, you know, the whole idea of the vaccinations, that it's building your immunity up against COVID. And so however that happens, you know, the main thing is what happened to your immune system. So if you come into contact with somebody with a different vaccination, I think the risk between you two is still really low.
Anthony needs to take off soon. So we've got one last question that came from the carpool community. A lot of service providers are doing pamphlet drops. This makes no sense to me as a carpool person. Is there anything happening for the blind community to get the information?
There is some information that's gone out in audio recordings to the blind community. I'm just trying to remember how long ago that was done, but there were some sent out. I just got to remember how it was pushed out. I think it was pushed out through the Blind Foundation as well, because obviously they have an existing network of how they get audio out to them. So that it was also preparing them for the vaccination program, how the vaccination scheduling for them would occur, that someone would call them, have that conversation with them, how they would be collected, and how the consent process would happen. Because it was verbal by then at least, but for some of the people in the beginning, they had to sign a consent form.
Okay. Cool. Liz, that might be something you can chase up with your communities and your networks. Look, I'm aware that you need to disappear, and that's all the questions that were given to me. I think we can wind up now, but just the reminder that we'll have more of these sorts of conversations. We're going to have another one next week. We'll contact you to give you the Zoom invite, and we'll carry these conversations on with our service providers. Just to thank you, Anthony and Lily, for the opportunity. We don't get enough of these sorts of opportunities in the disability community, and that's the reality. And there has to be more work done among our services and our communities to make sure that the information is culturally relevant, is community relevant, and is disability accessible. And if it hits all of those criteria, then everyone can access the communications. And the sooner that authorities realise that, the better. So look, thank you everybody. You now are more equipped, much more equipped to go out there and have the conversations with your communities. You're all leaders, you're influential. It's been awesome to have this session. I'm going to now hand it back to Dana to finish off our day. And just thank you again for everyone coming along. So kia ora mai tātou.
Amen.
Thank you, everybody. Thank you, guys. For coming. Nice to see you all. Ka kite.
Ka kite.